The progress in medical science is indeed a boon for humanity, and one such medical advancement is laparoscopy, especially for women. Gone are the days when they would have to bear the brunt of open surgeries. All laparoscopy needs is a small incision, and relevant gynecological disorders can be effectively treated. To understand the benefits of laparoscopy in gynecological disorders, I spoke to Dr. Anne Minnie Matthew from Aster Clinics and Hospitals. So, Doctor, what is laparoscopic surgery?
Laparoscopic surgery is a minimally invasive surgery where we use minimal incisions on the body, and we use camera and the laparoscope, which is attached to a camera, so that we get a better visualization and it is easier to operate.
What are the main advantages of laparoscopic surgery?
It's a very patient-friendly surgery, I should say. Though we are doing the same procedure like open one inside the abdomen, it is for the patient it is very friendly in the sense the recovery time is much less, as I said earlier, and aesthetically also minimal scar. Exactly. They wouldn't even know that they had a surgery. So that way it is very advantageous.
And I'm sure less pain.
Yeah, definitely less pain because of the cut is very less. And when we are cutting away, initially in the earlier days when we do open surgeries, we used to tie up and cut, and that because of that knot there would have been much more pain. Here we are just sealing it up, coagulating and sealing, so the pain is much less. And also the complications are much less, especially the adhesion formation. When we do an open surgery, there is a chance that the organs can get stuck to each other after the surgery because of the air exposure, and also we are handling with gloved hands, and blood loss also is more with open surgeries. So all these factors lead to the sticking of organs together, which is far way less in laparoscopic surgery.
So of course I've heard that laparoscopic surgery is obviously better for all gynec diseases, but people are still going in for open surgeries. Why?
I feel that awareness and acceptance among women is less about the advantages of laparoscopic surgery in gynec diseases. Usually the uterus and ovaries, the reproductive organs of women are situated deep in the pelvis, and laparoscopic surgery definitely, with a camera connected to a monitor outside the body, gives us a better view and for the surgery. So that itself, for the surgeon itself, it is very advantageous. And earlier we used to make such big cuts, and the recovery time for the patient was definitely 7 to 10 days, whereas for laparoscopy it is just 1 or 2 days. And usually 5 to 6 hours after the surgery, patient is up and about, and they can resume their duties within a few days. Yeah. So,
and that's the biggest advantage.
Yes. Though laparoscopy was offered in the past 30 years, and it has evolved a lot because of the lack of expertise. It was not, available in all hospitals.
Right.
So people were following the traditional open surgery for all diseases, and hence the acceptance even among doctors is, I should say, it is lesser than open surgeries.
Oh.
But once you start doing laparoscopy, I feel as a laparoscopic surgeon, I feel it is, I don't want to do open surgeries anymore.
Yeah, because there are so many advantages attached to it. So what are the surgeries that you can actually do for gynec diseases?
If you say that in a woman, any surgery other than cesarean section can be done with laparoscopy. But again, it depends on the expertise of the surgeon who is doing it. Earlier we used to do, cyst in the ovary, whether it is big or small, all those things we used to open and do. But then laparoscopy is such a simple procedure. Within half an hour the surgery is over if it is an ovarian cyst and big fibroids. Even uterus can be removed laparoscopically much easier than we used to do the open way.
And as you said, over the years, laparoscopic surgery has evolved.
Definitely.
And it's become way easier than it used to be before. Can it be done during pregnancy? I'm sure my viewers would like to know that.
Yes, definitely it can be. Of course, when we say that pregnancy, there are people who ask me whether they can even bend. So for them to accept laparoscopic surgery is a bit difficult, but then laparoscopy is definitely easier and faster in a pregnant woman. Usually we do it for women with appendicitis and women with ovarian cysts which have tottered and which can cause severe pain. In such cases, we need to do laparoscopy. And with laparoscopy, there is less handling of the uterus and the surgery is faster than an open one. So it's definitely better to do laparoscopic surgery in the early months of pregnancy. Yep.
And how has it evolved over the years?
Initial years, when they started off with laparoscopy, say 50, 60 years ago, there was not even a proper, camera was not available. They had to look into the abdominal cavity through the ports and do that about 60, 70 years ago. But then in 1980s, the video laparoscopy came in. And then after that, even the instruments with which we are doing the surgery has evolved so that, it's much easier to use it. Even robotic surgery also is an improvised version of laparoscopic surgery. So even 3D camera is available. So the laparoscopy has become much easier now.
It's great the way medical science is evolving and making all our lives way more easier than it used to be and painless. I think that's most important.
True.
Thank you so much for coming on the show, Doctor.
Thank you, Ma.
I hope there was some vital information for all my viewers. And remember that the groundwork for happiness in life is good health. So take good care of your health, and happiness is bound to be in the air.